Here are some steps to help you conquer your fear. Now, I know a lot about fear because I sought care for my child's medical condition. I kept going for doctor's visits with my child, even though I experienced some second thoughts about going for yet another doctor's visit. Many doctors seemed so busy and so booked up. I felt discouraged when I heard that the wait time to see the next doctor would be a month or more from now. I feared that the doctors who were so busy when they saw me and my child would not really spend the time listening before they had to go to see the next patient. After all, many doctors have only 15 minutes to see a patient, maybe 30 or more if there's a new evaluation. I remember going to so many doctor's visits where I felt rushed. I left with more questions than I came in with, and I'm a doctor. By the way, I love doctors. I'm one of them. I feel for them because many don't really have that much control over their schedules. Someone else, perhaps a hospital administrator or a practice owner, seems to have more control. They're trying to do the best they can within the time constraints that they are given. Even though I'm a little embarrassed to share this, at some point I just started thinking that the medical knowledge base from feeding challenges in small children was so small compared to knowledge base in other fields of medicine. Same thing with reflux, same thing with colic, same thing with food allergies. So small compared to some of the other ways that we are evaluating patients. For instance, we now have all these sophisticated tools that can look at your eyes. If you need eyeglasses, these tools can get a rough estimate of your prescription, even without us having to say anything or do anything. We don't even have to look at an eye chart. Not so with children who have difficulty feeding, who have colic, who are crying a lot, who have these symptoms of reflux, or who have food allergies. If you ask a doctor for a medical explanation, there's no perfect test that they will give you to be able to answer that. Given that, I truly wonder what else another medical appointment or another appointment with another healthcare provider could add. I know, the field has to become much more research, and it's one of the things that I'm hoping to do with my platform, to bring more to the field. Help all of us who have a young child with whom feeding seemed hard or who are concerned about food. In any case, I have fear that my child now will go to yet another doctor's visit and be given the same answer. We really don't know. In the process of not giving into my fear and going to those evaluations anyway, I met doctors who really listened and who cared. We eventually were able to get appropriate evaluation and testing. That made a big difference in terms of the diagnosis. By persisting and by seeing the appropriate specialists, in the end, it helped. That's the thing. Having a child with feeding challenges can result in you having to do things as a caregiver that you might not have to do otherwise. Feeding challenges or challenges around food or some of these other challenges that you have in young children can take caregivers out of their comfort zones. As just one example out of many, this includes having to find time to go for medical appointments or therapy appointments, but fearing, especially with the current worldwide pandemic of COVID-19, will COVID-19 be at the doctor's office? I know that COVID-19 can possibly be caught anywhere, not just during medical appointments, but anywhere. And I know that a lot of doctors are really careful in their offices to make sure that there's that disease. But I was fearful of that part anyway. Another fear is the fear of knowing that medical bills can be expensive and not knowing how much the next bill will cost. The fear also included having to keep a bag in my car for either visits to the emergency department, to the urgent care center, or to the doctor's clinic, depending upon my child's symptoms. It also includes the fear of not knowing when the next time will be when your child develops a significant symptoms that need an urgent care visit or a visit to the emergency department. There are still many opportunities for fear to creep its ugly head when you have a young child with feeding challenges or challenges around food, and that fear can be paralyzing. Here's something that I learned regarding the fear. In the past, I was able to have great visits with doctors. I was able to get closer to a diagnosis. I was able to get just the right feeding appointment for my child. I was able to introduce that new food without my child having an allergic reaction. I was able to get my child to grow. I was able to do these things even though I had fear at those moments too. That fear of yet another allergic reaction, another poor feeding day, another moment of stunted growth, another day of not knowing the medical reasons for the feeding difficulties. All that fear. That was just my lizard brain or my fear emoji trying to keep me in my comfort zone, trying to tell me not to try so hard, even though this is my child. This is what other parts of my brain are saying, hey, I'm going to do everything that I can for my child. I will walk to the ends of the earth for my child. However, the lizard brain or the fear emoji just wanted to stop me in my tracks. Despite what the rest of my brain was saying, I still had fear. I also learned that every time I do something new, every time I have a frustrating day, every time that the day doesn't go as planned, I get back to my lizard brain or my fear emoji reacting. I've gotten used to the fear. It's a part of me. Fear is a part of all of us. When this fear emoji or the lizard brain starts to talk to me about all of its fear, I stay present with it. I take 3 cleansing breaths. 1, 2, 3. And I tell the lizard brain, I acknowledge you. I know that you're feeling scared, overwhelmed, like you want to flee the situation, like you just want to give up and so on. I'm going to be present in this moment with you, and I will allow myself to keep what you're telling me. However, when I get myself right back up, I write a to-do list of what I need to do. I create a step-by-step plan. Then I put it on my schedule. Yes, I need to put it on my schedule. If I don't put it on my schedule, then it just stays on my to-do list. I haven't allocated a specific day or time to it like I would if it was on my schedule. I need that schedule. Some of you may ask, hey, Dr. Evka, what time of the day do you schedule the most fear-inducing tasks? I think that is a great question, and I'm reminded of the Mark Twain quote, if it's your job to eat a frog, it's best to do it first thing in the morning. And if it's your job to eat 2 frogs, it's best to eat the biggest one first. What I schedule for the first thing in the day is an action that I know that I'm not going to necessarily get the most pleasure out of. Yet, once it's done, that activity will no longer be hanging over my shoulder. By just doing that thing I at least want to do that day, I no longer have to do it. As soon as I'm finished doing it, it's done. I no longer have to worry about starting food trial if I've already started it that day. I no longer have to worry about what will happen if I try this technique at home that I learned during the feeding therapy because I've already tried it. I did it first thing in the morning. That thought of a green, big, slimy frog is no longer lingering in my brain once it no longer has to be. And I can then focus my energy on the next thing that I have to do that day. Plus, I think it's a nice start to my day if I put myself and give myself a pat on the back and say, good job, you did it despite the fear. And you can do the same pat on your backs too. Good job, you did it despite the fear. Little by little, through action, things happen. However, for things to happen, action needs to go in its place. That means that you acknowledge that what you're feeling and you need to do the next best thing anyway. Sounds like a popular quote in one of my child's favorite movies. But you must go on and do the next right thing. And if you need help with that, you can reach me and we can do some coaching together over at the Dr. Evka website. Now, if you found this to be useful, please subscribe to my channel and please like it. It helps other people to reach it and to be able to get some use out of it as well. Thank you. All right. See you again soon for my next episode.